That's great, thanks very much. We're going to cover a little bit about Aberdeenshire itself, the process that we've went through to develop our action plan, some of the challenges and some of the solutions. So what we know about Aberdeenshire. In Aberdeenshire, there's about 14% of children and young people live in poverty, but it's a huge geographical area. So just over 7,000 of children and young people live in poverty. However, in some local areas, that would be 2%, and others it's 25%. So there's a huge difference. Poverty affects families that are in work and out of work. The households that are most affected are households with more than 2 children and have an adult or a child that has a disability. We also know that it's a myth that people living in poverty is a lifestyle choice. The reality in Aberdeenshire and everywhere else is low wages, high living costs and limited opportunities. The cost of housing, childcare, transport are high in Aberdeenshire, and it impacts on limited households. We also know that the Community Planning Partnership in Aberdeenshire see this as a high priority, and they do want to work together to eradicate child poverty and made it one of their local outcome improvement areas. I'm going to pass over to George, and he's going to tell you about the process we've been through.
Thanks, Annette. If we could maybe just move on to the next slide. Sorry about the chopping and changing. Morning, everyone. I thought it might be helpful maybe for us just to touch on a wee bit of the kind of policy and strategic context in Aberdeenshire, actually, and some of the things that we've found have helped at an Aberdeenshire level in terms of driving forward the agenda so far. As Annette said, back in 2017, our CPP board took the decision to ensure that action around child poverty was one of our Lloyd priorities. So that's been very helpful in terms of starting to get a kind of strong degree of buy-in across the partnership. It's certainly been very helpful in ensuring that there's a fair degree of kind of scrutiny and sound governance in relation to our plans and proposed actions. And it's also helped to support some of the kind of more challenging conversations which we've by no means bottomed out, for example, around how we actually resource our quite ambitious plans. For us in the Shire, the CPP board were really keen that one of our key partnership groups, and it's a subgroup of our CPP board, the Tackling Poverty and Inequalities group, had the kind of lead role in terms of oversight and driving forward the agenda. And in addition to that, it was agreed that Annette and I, not that it's our full-time job, but we provide a bit of additional staff capacity to provide a kind of single point of contact for partners and to support partners in terms of thinking about what the implications of the Act and our local plan might be for them. One of the things I would say we're proud of, actually, in Aberdeenshire is the quality of our partnership relationships. We've got a good, strong track record historically about partners collaborating around more complex challenges, and we felt that would stand us in good stead in relation to the child poverty agenda. And our plan as it's developed so far, it's got about 23 or 24 kind of outline actions at this stage. And because of the kind of breadth of that, we've seen quite a wide range of partners, and beyond the council and beyond the NHS, seeing themselves as having an important role to play in supporting the delivery of that longer term. And if I go back to the kind of consultation period that Scottish Government undertook prior to the Act actually being in place, one of the kind of conversations around child poverty at that time was eradicating child poverty in Scotland, one of Government's ambitions. And that would be a very big ask, I think, for many parts of Scotland. But actually, for us in Aberdeenshire, it is a bit more realistic, that. We do have a lower prevalence compared to many other parts of Scotland. So there's a kind of sense among the partners that a concerted effort, we might just be able to achieve that. One of the things that really has, I think, helped to kind of support some of the kind of conversations around partners is some local research that we commissioned back in 2017. It was carried out by John McKendrick. John's over in the corner there, actually, and the Poverty Alliance, actually. And it's impossible to kind of do this justice in just a kind of few minutes, but it was a really useful reminder, I think, for partners about some of the kind of fundamental issues that would really need to address as partners. It very helpfully kind of reminded us that those not in work invariably want to work, but often face barriers, and often multiple barriers, to getting into work and sustaining work. And those are often principally around ill health and disability, the cost of transport, and childcare and availability of childcare and transport, caring responsibilities, for example. And what came through very clearly, I think, from both parents and guardians and children was, at the nub of it, was poverty serving to exclude parents and children from kind of wider society in a whole number of different ways, actually. And also I kind of sense that parents often feel stigmatised when accessing services, and often respond in a couple of different ways when that's the case, by either not choosing not to use that service into the future, and actually relying more on informal family and social networks. And that creates a bit of kind of unhappiness for kind of parents, because they were often conscious that in so relying on informal networks and family relationships, they were relying on people that themselves were struggling in their view. So just to say a word or two about our kind of plan, well, we've tried to ensure that the plan really has a kind of major focus on the kind of root causes of poverty. The kind of 23 or 24 actions that we have thus far are really kind of nested within kind of 4 overarching goals, which you'll see on the slide there, which are kind of principally about actions designed to really prevent children on the margins falling into poverty, reducing the number of children living in poverty by supporting and moving those that are in poverty out of it, protecting children and families from the kind of most adverse effects of poverty whilst they're in poverty, and hopefully in the longer term enabling children to lead a poverty-free adult life. And I think it's already been touched on a number of times today, actually. One of the things that our CPP board were really keen to see was that lived experience of poverty absolutely kind of informed thinking, service delivery moving forward. And I know Annette wants to touch on that just a point more.
Like all of you, we've got some challenges in Aberdeenshire. Delivering across a huge geographical area is one of the challenges. The perception of child poverty, because that did come up in the research, that some people did think it was a choice, and we know that that's not the case. So we need to do something about that and address that perception. There's also a perception of Aberdeenshire within and out with. We're not all rich with oil and gas. That is not our main employer, thanks very much. It's the public service. So there are challenges there. And also, when you're talking to partners within Aberdeenshire, we need to raise awareness of the levels of child poverty. The high cost of living, transport and digital access. We don't have broadband everywhere, and in some areas it's still dial-up, so it can be really expensive and really tricky to access services in a rural area. And the thing that George has already mentioned, the stigma felt by families. In this day and age, people should not be feeling that because of their economics of their family, they should not be able to access services. So that was a big challenge for us. So areas of development, further work needs to be done. This is not going to be an action plan that sits in somebody's cupboard and only comes out once a year when we have to report to the Scottish Government or Council or NHS. This is going to be a work in progress, and so we are working with our partners to make sure that they pledge and say what exactly they're going to deliver. And that's from very local community-based partnerships right up to the senior managers of the Council, NHS and our community planning partners. We want to continue to engage with those with lived experience because their voices, we need to hear them all the time when we're making decisions, because what we think might be right might be totally wrong for those families. And what we have done is listen to them, and they do not want to come face-to-face with each other. These are very small rural areas. So we're looking to develop an online forum, a safe space, where they can actually talk together. because they don't want to be identified because of the stigma. But we need their voices, and we do want them to participate in co-delivery and co-development of services for the future. So we've got very high levels of in-work poverty. So one of the ways that we are looking to reduce that is we might not have lots of funding coming in for employability, but what we do have as a partnership is we have procurement power. So we are looking to make sure that the community benefit clauses that we do use already enhance provisions for us, so that we are supporting companies that are living wage. We are looking to make sure that there's other opportunities there for young people and older people to get back into work. And we're also looking at the quality of the jobs and the sustainability of employment, and we're doing that through procurement. And to reduce the stigma that people feel, we don't want anybody not accessing services because of how they've been made to feel. So we're looking at a joint CPD, and we're looking to make sure that those families with a voice are part of that, and to make sure that we are doing that right across our partnerships. We are looking also to deliver services a little bit differently. So instead of doing it from an organisation point of view, we're looking at where the clients will access services and using trusted venues. So like we have a welfare rights worker and a GP surgery, and I know some of you, this is not new, and some of you already do that, but that is where people are, and we're looking to deliver services for the clients, not for the organisations. So I just want to take this opportunity to thank you for listening, and we're here to learn loads. So.
Oh, yeah, absolutely, yeah.